Hi, I'm Colbert, and I'm here tonight at the 12th Annual ACG Healthcare Conference in New York City. Having a great evening here. We had some great speakers and panelists earlier, and now we've got great networking and bourbon tasting going on. I'm here today with Andy Colbert with Ziegler, who was one of our moderators at a session earlier. Andy, thanks so much for spending a few minutes with me.
Yeah, it's a pleasure to be here, and it's a great time of year to be networking with close to 500 deal professionals across the healthcare landscape, and you can just hear the energy is in the room.
Perfect. Why don't you do me a favor, just introduce yourself and Ziegler a little bit, and let us know a little bit about you and the firm, and then we can talk a little bit about the conference.
Absolutely. Yeah, so I'm the Senior Managing Director at the firm. Been with Ziegler 14 years. We're a pretty unique firm. We're one of the oldest, if not the oldest, healthcare investment bank in the country. The firm's over 115 years old. The legacy of the firm is actually providing financing to hospitals and nursing homes across the country. And then I came over in 2006 to build out the M&A practice. So I've worked on over 40 transactions, $3.5 billion in value. Spent a lot of my time with physician practice management situations and M&A deals, joint ventures, but have done a lot over the years in revenue cycle management, healthcare technology, really a diverse offering. And we have a pretty unique firm. We're an employee-owned firm. We're very culturally focused. We really try to bring our kind of excitement to the job and try to make it an enjoyable place to work.
Great. So you've seen a lot in your time with all the transactions that you've been involved in. I'm curious, from a healthcare market perspective, where are you seeing investments today that maybe would have been different than a year or two ago? What's the shift look like?
Yeah, I mean, listen, I'd say there's still a massive overhang of funding dollars, and there's more capital than there are deals. I'd say certain sectors kind of go up and down, in and out of favor. I'd say right now we're seeing a lot of focus on cost containment, opportunities for moving more towards risk-based models or population health, whether it's on the physician clinical side. You've got a lot of models around care coordination and specialty operations, as well as technology and unique kind of payment analytics companies. So that's an area we're spending a lot of time in as a firm. I'd say behavioral health is definitely a big area, as you heard Laura talk about today.
Right.
Laura Faris, who I interviewed, is the #2 person at New York Presbyterian, which was really a phenomenal guest for us to have. She talked a lot about the social determinants of health and just kind of the behavioral side of things that just doesn't always get a lot of attention, and that's obviously a big focus. So behavioral is obviously really big. And then I'd say the other area where we're spending a lot of time is telemedicine. Really driving care to the individual, whether it's at home or bringing specialists to a care setting where they might not have a specialist on site, right?
Sure.
And so that's a big area. And I think the big question mark in everyone's mind is, what are the employers going to be doing in healthcare, right? The big, the Amazons of the world building their own clinics. CVS announcing with their deal with Aetna now that they're going to be rolling out into 2,000 locations.
Right.
And
Walmart, I think, just recently.
Walmart, and that. So I pressed Laura a little bit on that. I'm still a little confused myself as to where does that all fit in. Because on one hand you've got the big hospital systems trying to build their own physician groups, their own urgent care, and then you've got these retail chains that are saying, we want to be the first layer of healthcare. We want to be your primary care model. And so, I think fundamentally, it's a race to really control primary care, because that's ultimately the gatekeeper of healthcare. Right? And whoever controls primary care gets to manage all those downstream utilizations. So that's a trend that's just, you look at United Health, they're now the largest employer of physicians in the US. I think they have something like 50,000 physicians inside their Optum Care entity, which is just massive, right? And so I continue to watch them as probably the single biggest threat to the provider ecosystem. They own an urgent care company. They own businesses that do all kinds of medication management. And then I'd say we haven't talked today a lot about pharmacy. And clearly the administration is picked a focus on pharmacy. I still think that's an area for rapid reform that we haven't really been talking a lot about here.
Well, there's certainly no lack of areas of opportunity when it comes to healthcare. It's such a large, diverse sector, and so critical to so many aspects of the economy and society. And obviously, as you know, there's so much money being invested in it. There's certainly no lack of opportunity.
Right. No, it's an exciting time to be in healthcare. I mean, and especially with the election year. I mean, you couldn't ask for more of a nail biter, right? In terms of where is the healthcare pendulum swinging? I mean, my view is either direction, there's still tremendous amounts of opportunity, right? I mean, on one hand, you're going to see probably a little bit more reform and kind of more government influence on the care side if it yields more democratic. But if it continues on the Republican, driven agenda, I still think you're going to see, even if it's private sector push, that's going to drive more transparency with the Walmarts and the CVSs and the Amazons of the world.
It's certainly not fading as an issue or into the background anytime soon.
Definitely not. And I think it's also it's an issue for all of us in our own daily lives, right? I mean, the cost of healthcare is rising at, literally twice the average wage growth, if not higher for some individuals. And it's just not sustainable.
No, absolutely. So let me shift gears on you for a moment, if you don't mind. You can be doing a lot of things on a Thursday night. You're here in New York at the healthcare conference. Why is this a good investment of your time, and why is ACG the right place for you to be?
So, I'm a huge proponent of, networking in your local market. I live in New York. We have our office right here next to Grand Central. I think all too often, we're traveling across the country to meet people that live right in our own backyard. So, I love the opportunity to network locally. I think New York tends to be actually a more challenging environment to network because it's so big that you almost overwhelm yourself with opportunities. And so I think this is a great venue to get bankers, investors, lenders, intermediaries and service providers, company executives all together, and really just talk about what's on everyone's agenda. ACG does a tremendous job at promoting a lot of deal activities and deal flow. A lot of it is more agnostic from an industry perspective. This is one of the few events that's pure healthcare. For myself, I don't always find the agnostic stuff as valuable. To me, the pure healthcare events, because that's all we do, we're not a multi-industry firm. This is really where we get the bang for our buck, and so we're thrilled to be a multi-year sponsor. Really thrilled with the leadership team at ACG, and they put on a good spread.
Great.
Yeah.
Great. Well, I'll let you get to some bourbon.
Thank you.
I'm so glad that you were here with the panel earlier, and thanks for spending a few minutes with me.
Yeah, appreciate it. Thank you.
All right. Well, I've been talking with Andy Colbert at the 12th Annual ACG Healthcare Conference. That's a wrap.